The friction extends really deep into the administrative and cultural realms.
Let's get into that administrative minefield because just crossing the border for treatment is a massive hurdle. You can't just show up on a tourist visa if you're seeking long-term medical care.
No, absolutely not.
You need a highly specific medical visa, an S1 or S2.
And Chinese consulates require a pristine paper trail for those visas. You need an official invitation letter from one of those Class 3A hospitals, complete with a detailed clinical diagnosis and a really firm treatment timeline.
And the financial proof required for that visa is what really caught my attention.
Oh, the 120% rule.
Yes. To prove you won't become a burden on the Chinese public health system, you often have to show frozen bank funds or statements proving you can cover 120% of your estimated medical costs.
Right.
You have to lock up significantly more cash than the surgery even costs just to get on the plane.
It's a huge barrier. And once you clear that hurdle and finally land, there's a massive legal trap waiting for you, the 24-hour police registration rule.
Right.
The law states that if you are a foreigner and you are not staying in a commercially licensed hotel, say you rent an apartment near the hospital for a month, or stay with a friend,
Yeah.
you have exactly 24 hours to physically go to the local police station and register your temporary residence.
I can see how easy that would be to mess up. I mean, if you are rushing a loved one from the airport straight to the emergency room, finding a local police precinct is literally the last thing on your mind.
Exactly. You can sometimes do it through a specific online portal, but it's often entirely in Chinese.
Of course.
And missing that 24-hour window can result in a 2,000 RMB fine. Worse, they can put a black mark on your immigration record, which could get your medical visa revoked right in the middle of your treatment.
Which brings us to the psychological toll all of this takes. Because the research highlights an erosion of dignity that extends directly into the clinical environment itself, specifically regarding what they call privacy shock.
Right, because these massive hospitals are engineered to maximize efficiency for thousands of people daily.
Yeah.
So Western expectations of strict, closed-door privacy simply don't always apply. Like, a doctor might leave the consultation room door wide open just to keep the line moving, or the physical curtains around an examination bed might not be drawn perfectly tight.
Which means you could be explaining highly sensitive, embarrassing symptoms to a specialist, and the next patient in line is literally standing 3 feet away from you, listening, just waiting for their turn.
Yep.
For a patient who is used to a completely private one-on-one room, that isn't just weird, that's genuinely traumatizing.
It fundamentally strips the patient of their agency.
Yeah.
It spikes their stress hormones during an incredibly vulnerable time,
Yeah.
which, isn't just unpleasant. It can actually impact clinical outcomes.
Yeah.
So if the medical care is brilliant, but the digital system rejects your passport, the legal system traps you at the border, and the clinical environment strips away your privacy, how does anyone actually do this?
Well, they rely on a highly specific evolution of the service industry. They use a medical concierge.
And we're not talking about a travel agent, right? Like, you can't just hire a standard travel agent to book your flights and hope for the best.